Good morning. So I guess we'll go ahead and get started with the second panel. So my name is Maggie Hicken, and I'm one of the organizers of the symposium, and I'd like to take the opportunity to thank you for coming this morning and over the past 2 days, and I'd also like to take this opportunity to thank everyone behind the scenes. Laura Hopkins and Meredith McGee, who are in the Department of Epidemiology, have really helped. They've been kind of invisible, making sure that things run smoothly. And I'd also like to take the opportunity to thank Jeff Mornoff for facilitating our discussions yesterday and today. As Natalie and Karina and I are new to the study of mass incarceration and population health and health disparities, his expertise and guidance over the initial stages of our planning were instrumental in how we assembled our panels of speakers. So I'd like to say thank you to Jeff. And so yesterday we had a really wonderful conversation, and I'm really looking forward to the discussion today. So, in our final panel of the symposium, 3 speakers will provide very different approaches to the study of mass incarceration and population health and health disparities. First, Hetty Lee, an assistant professor of sociology at the University of Washington, will present her research on linking family member incarceration to physical health outcomes, with a particular emphasis on the population health implications for Black women. Hetty's research focuses on the social determinants of health and health disparities, with a particular emphasis on poverty and race ethnicity. In addition to her work on the stress of network incarceration, Hetty and I collaborate on a series of papers on the health effects of racism-related vigilance. And next, second, we'll have Emily Wang, an assistant professor of medicine at Yale University, and she'll present her work on the ways in which incarceration biases epidemiological studies on chronic disease in the general population. Emily has worked in prisons in North Carolina, southern China, Botswana, and California, where she co-founded the Transitions Clinic, a community-based post-release clinic for inmates. And finally, Christopher Wildeman, an assistant professor of sociology from Yale University, will present his research on the cross-national comparisons on the association between incarceration and population health. And through this lens, we can better understand the role that incarceration plays on U.S. population health. And currently, through his research, he examines the consequences of mass incarceration for inequality, with an emphasis on families and children and health. So I'll let Hetty take it away.
I just don't want that to be me. So thank you for the opportunity to present today. I wanted to mention that I was a Robert Wood Johnson Health and Society Scholar at the University of Michigan, and my interest and work in incarceration really began here as a scholar, and it was through collaborations with wonderful people such as Christopher Wildeman and others, as well as mentorship from people like Jeff, Anna, Jim House, et cetera, and many more that really helped to pique my interest in this area and to understand and try to start thinking about family member incarceration as an important stressor with implications for the health of all women, but particularly African American women. And I also wanted to mention, just to plug the Robert Wood Johnson Foundation, that I really think it's a leader in supporting interdisciplinary research, and I really think this kind of work can hopefully improve population health and reduce health disparities, which I think should be the goal of the kind of work we do, at least for me. And I'm also lucky that Megan Comfort has also talked a little bit about the implications of family member incarceration for women. And she talked about her research taking a view from below, so ethnographic research, talking about the experiences women were having with romantic partners, brothers, and others who've been incarcerated. And I'm going to try to take a view from above using some survey data to kind of show what this looks like in that context with a couple of data sets. So the goal for this talk is to understand the role of family member incarceration in women's health disparities, and I'm going to do that in 3 steps. So first, I want to discuss family member incarceration as a unique stressor and establish an association between having a family member incarcerated and women's physical health. And I'm particularly focusing on cardiovascular disease outcomes, so not infectious disease risk, which is an important outcome and something Maria Kahn talked a lot about yesterday. And then second, I want to quantify racial disparities in women's connections to those who are incarcerated. And I want to show that family member incarceration is disproportionately experienced by Black women, which makes sense given disproportionality in incarceration rates. And then third, I'm just going to speculate about the possible magnitude of these effects on health disparities among women and for population health. I won't be actually testing the effects on health inequality today, but trying to establish that they're likely to exist given what I show in these first two steps. Okay. So there's many reasons to believe that family member incarceration can impact not just the health of those who are incarcerated, but also those who are tied to them. And so I'm going to talk about some of the main pathways. There are multiple ways that this can happen during incarceration and after release. And I'm going to talk about some of the main pathways that might also specifically impact health. And again, their effects are largely negative, but there could be some positive effects of a family member being incarcerated. And Megan talked about the complexity in these dynamics, but on average, most of these effects are negative. And a lot of these have been discussed yesterday, so I'll be a little bit brief, but not too brief. So somewhere in the middle, hopefully. Okay. So a lot of work has gone into looking at the socioeconomic impacts of incarceration for individuals who have been incarcerated and their families. So there's a reduction in earnings, whether that comes from the family member who's been incarcerated from formal or informal labor market participation. There's also increased costs in staying in contact with family members. And so Megan talked about this, and she mentioned some work from Olga Grinstead, who showed that for women making less than $20,000 a year, that they spend 25% of their income on average keeping in contact with family members, and that's through collect calls, visitations, money in commissary accounts, et cetera. There's also legal debt incurred from monetary sanctions, which Alexis Harris talked about yesterday, that often are bared upon, the family has to bear those costs. Oftentimes, judges will ask them to do that, which Alexis talked about. And then there's also increased risk for union dissolution, which can also lead to a loss of a member in the household earning money for the family. There's also complex family relationships that are incurred once a family member leaves the household. Parenting becomes strained. Women have to take on multiple caregiving roles for children. There's also strained and complex romantic relationships for women, where they're both dealing with navigating a relationship with somebody who's incarcerated and sometimes having a concurrent partner, or dealing with issues of finding someone else and dealing with the return of a partner. And then lastly, probably the most difficult effects to quantify, but I think the most serious, are issues around stress, stigma, and isolation. And so research from other ethnographers, including Donald Brahman, talk about the fact that family members often feel stigmatized about talking about the incarceration of a loved one, particularly for coworkers, et cetera, but even sometimes for extended family members. And there's also lots of stigma and shame associated with visiting prisons. Visiting prisons are often grueling. The trips there, the conditions there, and treatment of the women when they're visiting can lead to feelings of stigma and isolation as well. And Megan talked about that yesterday. And also, there's just an important loss of your social support network. When a romantic partner or close family member leaves, that's one less person that you can turn to buffer other stressors that might be occurring in your life, which we know is likely to happen for most families who are dealing with incarceration, who are already probably disadvantaged before the incarceration occurs. And so I just wanted to, I'm going to give you Perlin's definition of stress, because that's kind of how I think about stress, and I think it's a good definition. So stress, or stressors, is the broad array of problematic conditions and experiences that can challenge the adaptive capacities of people. Stressors appear either in the form of disruptive events or the more persistent hardships and problems built into the fabric of social life. And so I'm going to argue that family member incarceration kind of is both those things. It's sort of an acute stressor and also a persistent stressor, because it leads to a cascade of negative effects. And so Perlin also has a theoretical framework where he talks about stress in terms of primary stressors and secondary stressors. And this can help us understand why family member incarceration is an important source of psychosocial stress. So the actual incarceration is this primary stressor, but then both during and after the release, the family members are exposed to a number of secondary stressors, like the ones I talked to you before: strained economic hardships and family dynamics, social isolation, and these lead to prolonged exposure to stressors and a cascade of other stressors, which Perlin calls stress proliferation, but you can also call chronic stress, is often used to term this. And chronic stress can leave the body at a heightened state awareness that taxes your cardiovascular system and your immune function, and this can lead to increased risks of both mental and physical health through multiple pathways, either through unhealthy coping behaviors or through direct biological pathways. And I'm happy to talk more about that in the Q&A. And given the racial disproportionality in incarceration, I'm going to argue that African American women are particularly impacted by these experiences, and I'm going to try to show that to you in step 2, so I'll return to that point. So I think these stressors in totality increase the risk of CVD, and disparities in the stress, family member incarceration, might contribute to CVD disparities, so cardiovascular disease disparities. Okay, so for the first part of this, for step 1, I'm going to use data from the National Survey of American Life. And this is a survey of a broadly representative survey of African Americans throughout the U.S. in urban and rural areas where there are significant numbers of black men reside. And so there was an interview, 6,000 interviews took place, and these are adults 18 and up. And about 3,500 were African Americans, 900 non-Hispanic whites, but these are whites that are also living in primarily black communities. So this is a specific white population. And then a population of black respondents with Caribbean descent. Okay, and so one of the unique features about the NSAL is that it's broadly representative of African Americans. There is this control group for whites, and it has many health measures. They are self-reported. I wanted to mention that, and I'll mention it again, because that's important for those of us who do health. And there was also a question asked in the survey about a family member being away from home because they were in prison or jail. And I'm going to read the terminology because it's important to understand how they're defining relatives in the question. So the question is, now I'd like to ask you a few questions about your family members who live away from home. Do you have any family members, and this includes a husband or wife, child, mother, father, brother, or sister, who are away at any of the following? And they give a list of things. One of them is jail or prison as one option, and the other options are school or college, the military, and a long-term care facility or nursing home. And this is actually one of the only broadly representative surveys that actually has a question like this, and in addition to questions about health. And I'm going to focus on the women for this analysis, but we did run the analysis for men, and I'll tell you about those results. And in this sample, 7% of the women had a currently incarcerated family member. So this is a family member who is currently in jail or prison. So these are the health outcomes that we examined. So all of these measures are self-reported, and they were a self-report from a doctor diagnosis for diabetes, hypertension, heart attack, or stroke. And obesity was calculated from self-reported height and weight. And we also used a measure of self-reported fair or poor health. Okay, so here are the results. I'm being brief because I have to show 2 studies. So in this first row, these are the age-adjusted results. And I should say that I also included, we also included a measure of family members missing due to the other reasons that were asked in the survey question that I mentioned before. And you can see here that family member incarceration is associated with increased risks for all of the health outcomes that we measured, so obesity, diabetes, hypertension, heart attack and stroke, and fair or poor health. Our fully adjusted models include a range of demographic controls for childhood SES and health insurance status, et cetera, a foreign-born status as well, given the Caribbean population, relevant health behaviors and conditions specific to the health outcome, and we also controlled for own incarceration. And in these fully adjusted models, what we found was that family member incarceration was associated with obesity, having a heart attack or stroke, and fair or poor health. So, of course, this is cross-sectional data, and there are limitations to our interpretations, but we think this at least signals that family member incarceration has there is a negative association between family member incarceration and women's physical health. And there is actually, and I should have mentioned this before, there's no association between family incarceration and health for men at all. Even in bivariate models where just family member incarceration is included, there's no association. And that these associations are robust to own incarceration history. Okay, so now that I've tried to establish at least a signal of the possibility that family member incarceration is impacting physical health for women, I also want to talk about inequalities in connectedness to incarcerated men. So we do know, maybe imperfectly, but better than for other statistics, the number of men in prison, and to a somewhat good degree, the number of children with an imprisoned parent, and demographic differences across these groups. And so we often have heard in these presentations and others the huge racial disproportionalities in those who have a parent who is in prison and those who are imprisoned. But we really don't know as much about the other people that are connected to prisoners. So we don't have really good estimates on how many women and men know an inmate and across what context. So who in your family do you know who's incarcerated? Who do you know? Who in your neighborhood is incarcerated, et cetera. We are starting to get that information, but we don't know that very well. And we don't have as much information on the inequality in these distributions by race and ethnicity. So for this step, I'm gonna use data from the General Social Survey, which is a household survey. So, and so is, I should have mentioned the NSAL is as well. And the GSS is a nationally representative survey of Americans, non-institutionalized adults, and I'm gonna use a special topic module of the 2006 GSS. And the reason I think this is an important module to use is because you can capture two things. One is you can create population estimates of people connected to those incarcerated across a variety of contexts, and I'll talk about those. And there are questions that you can use to adjust for network size. So African Americans on average have smaller social networks than whites. And so that the average difference is about 100 people, if you're talking about people that you know. And so if we really want to understand the density, the density of connection, so something that Megan Comfort talked about when she was talking about interviews with a woman who had brothers and sisters and cousins, et cetera, connected to you, you have to know what the proportion is of those who are incarcerated that fill up your network. And so I think that this makes these network adjustments an interesting thing to look at, and disproportionality in this important. And then we can also kind of look at the breadth of the effects. How many people are impacted in general? How many people just know at least one person who's incarcerated? And are there disparities in those connections as well? So the GSS asks a couple questions, and the first questions to use to establish who you know who's incarcerated comes from this question. It says, I'm going to ask you some questions about all the people you're acquainted with. So this means people that you know their name and would stop and talk at least for a moment if you ran into them on the street or a shopping mall. And then they ask after this, how many are currently in state or federal prison? And then in addition to asking about people that you know, your acquaintance network, they ask you about people who are in your family, including relatives and in-laws, people that you're acquainted with through your neighborhood, and also people that you trust. And so these are people that you would discuss important matters with, trust with advice, and with money. Okay? And then after asking these questions, there's a series of questions that are asked about to be able to estimate your network size, and I can talk more about that in the Q&A, but there's some interesting and novel ways where you can use additional questions to then estimate network size. So for this figure, I'm showing you the black-white ratio of the proportion of a network in prison for women. Okay, so this is showing you the proportion of incarcerated individuals in a black woman's network over the proportion of incarcerated individuals in a white woman's network. And so these are showing you the disparities in these connections. And so, which is what the main theme here is that for across all contacts, people you know in your family, et cetera, black women have a much larger density of incarcerated individuals in their networks. Okay, so for example, the proportion of incarcerated individuals in average black female's family network is 8.5 times higher than that of white women. Okay, so these are sort of the densities of connections that we see. So there's definitely, like Megan talked about, African American women have a much larger proportion of people that they're in contact with and make up the core people that they are associated with across contexts compared to white women. So these next estimates are showing you disparities in connections, or so the breadth of connections to those by race. So this is for women again, the proportion of women who know at least one person that is currently in prison. And again, we can see that there are large disparities in connection. So 18% of African American women have at least one family member that they know in jail or prison. And you might notice that these are a little bit higher than the National Survey of American Life estimates, and that's because the question for the NSAL was a little bit more confined in terms of who was defined as a family member. Okay, so I'm going to show you this in a different way. So this is, again, looking at comparing the current, so this is incarceration estimates for black and white males in 2006 using the BJS prison and jail inmates mid-year estimates. And then I'm comparing these to the estimates of how many individuals, black and white females, knew who were currently incarcerated in the GSS. So again, 1 in every 15 black males 18 years of older was currently incarcerated in 2006. And in 2006, 1 in every 6 black females at least 18 years or older had at least one family member who was currently incarcerated. And so that's about 3.6 million women. And in 2006, 1 in every 106 white males 18 years or older was currently incarcerated. And for white females, 1 in every 23 white females had at least one family member who was currently incarcerated, and that's about 5.3 million women. And so again, one thing to note is not only that there's racial disproportionality in connections to those who are incarcerated, but that for all women, there are high proportions of women who are in contact with prisoners. And these are, again, just currently incarcerated prisoners, so it's sort of an underestimate because we're not capturing people who have been released or under other forms of supervision. Okay, so in the first step, I showed that the physical health implications of family members. I went really fast, sorry. You should be happy, it's Friday. So in this first step, I showed the physical health implications of family member incarceration using the National Survey of American Life. And in the second step, I showed that the experiences of family member incarceration are not rare, and that lots of women are connected to those. Lots of American women are connected to men who are currently incarcerated, and there are large differences in connections by race. And again, this is likely an underestimate because we're only talking about people who are currently incarcerated. So I wanted to end with talking about implications for mass incarceration. And so critical race and feminism scholars often talk about the unique experience of African American women, who are also, I would argue, often invisible in policy discussions and research. And I think it's because and what these scholars argue as well, is that their social status lies at the intersection of multiple historically oppressed, disadvantaged social statuses. So this makes them particularly vulnerable. So African American women face the highest rates of poverty, poor health, and violence compared to any other demographic group, or at least most other demographic groups. And this is because they're disadvantaged due to their gender and their race. But another argument that has been made is this idea of a third burden. So as long as the well-being of black women remains tied to that of black men, they are also disadvantaged by the problems that black men face. And this is often called the third burden. And Megan used the term as well yesterday, the family support incarceration health nexus. And I really think it's important to think about the disproportionate burden that women face or bear when a family member becomes incarcerated and post-release, and that this may have especially significant effects for African American women. And if this is the case, we really do need to think more critically about the implications of family member incarceration for these women and their well-being. So all women in particular, but especially African American women. And so I just also wanted to mention, because I got some comments about this when I was showing this presentation before. So this actual figure from a political cartoon from the women's movement in the early 20th century. And so I doctored it above. So it was highlighting the gender oppression that was occurring at that time. So I added the race and fate of black men to the figure. So I think we should think about family member incarceration as being a unique stressor that contributes to health disparities because I think it adds to a cumulative burden of disadvantage. Whether families have been disadvantaged prior to incarceration, I think this makes things, this exacerbates already occurring stressors and creates new ones. And I think that's important because as a person who studies stress, it's important to identify unique stressors, but also identify stressors that make other stressors harder to manage and cope with. And incarceration does that by removing social support and increasing additional risk factors and sets of stressors and other kinds of burdens. And I think future research really needs to interrogate the mechanisms that link these experiences together. So how does family member incarceration link to poor health? And also formally test the role of family member incarceration in impacting health disparities. And I also think we should include relevant questions in longitudinal data sets and additionally collect more ethnographic research to also help us tease out these mechanisms. Okay, I'm done now. Oh, wait, no, I'm not done. Wait. I forgot to thank my collaborators, a lot of them who were ironically on the panel. So Christopher and Emily, Nikki Matusco, and Tyler McCormick, Maggie Hicken, and James Jackson. Okay, now I'm done. Thank you.